So I have bipolar disorder type 1. Uh, I have been through an enormous amount of trauma, and what used to be PTSD is now post traumatic growth. Uh, I suffer from depression when it's dark outside or low light conditions, and my life used to be really, really bad, but now I've learned how to live a good life even with my mental illness, and I wanted to share with you some of the things I do to stay well. First of all, I take mood stabilizing medication. Now, the medication thing is a real, I had to try a lot of different meds to find the one that worked for me. I found a mood stabilizer that worked for me. Now, and when I was in my deep depression, I needed an antidepressant to lift me up a little bit, but then I got off of that. Uh, your meds change as you go on your mental health journey. And that's a dialogue that you have with your doctor. You talk to your doctor about how the meds are affecting you. You read information about the medications so that you know what's going on, so that if you start having side effects, you can see, okay, this is predictable. I gave up smoking weed and I stopped drinking alcohol completely. And there's some 12-step programs that I go to help me with that particular issue. I go to support groups for mental health, and I find it helpful to be with other people that understand. I exercise 3 times a week. I go to the gym and uh, lift weights and do the treadmill. I've changed my diet, so I'm eating a lot healthier than I used to eat. I cut out dairy products and milk, bread, pasta, bread, rice, bagels, stuff like that. And I, you know, I'm not, I don't know, I'm just trying to be more mindful about what I put in my body. And sometimes I just need to be in the light, go outside and get some vitamin D therapy, just sit there. That'll help me. And I talk to a lot of people on the phone. There's these things called warm lines or peer support lines, and I call many of them. They're all over the country, and I make good use of them. I avoid dangerous people, places, and things. I avoid my family. I talk to a couple people, but I don't visit because it's not good for me, and that's very painful aspect of my life, but it's something I have to do to protect my sobriety and protect my mental health. Uh, I just I'm active in my community. There's things that I enjoy doing. I like watching movies from the library. I like reading books. I like cooking and playing some guitar and and I do stand up comedy, and that's really fun for me. But I guess what I'm saying is, if you have mental illness, there are solutions. There are ways of living. We don't have to suffer, and life doesn't have to suck all the time. We can heal, we can get better. I found it helpful to learn about the illness, my particular illness, and therapy has been essential for my mental health. I see a therapist once a week, and I don't know what I'd do if I didn't have a therapist. So uh, I had to switch from complaining and living in the problem to seeking solutions to the problem. And treatment works, recovery is real, we do get better. You might want to take a RAP class, Wellness Recovery Action Plan. That's a good class to take. And there's a voluminous amount of information. Self care is essential. I bathe regularly. I need to take a shower right now, but Sometimes I'll take 3 showers a day, just to stay clean and feel good. Making my bed helps. It improves my morale to see my bed's made and the dishes are done. I used to be so depressed I couldn't make the bed and I couldn't do the dishes. So I just wanted to offer some solutions and some help and some information. The Body Keeps the Score, great book to understand trauma. Uh, and Kay Jamison has some good things to say about bipolar disorder. They're learning more about this every day. I encourage you to read the Greek myths. That helps. Joseph Campbell helped me. And just get into some joy. Follow your bliss. Find something that you love to do. And yeah, it'll get better.